I'm Liz Mear. I'm Chief Executive of an organisation called the Innovation Agency. And I came to this role, I was a hospital chief executive, and in that role I also chaired a research network, and we did some fantastic research activities around technology, operations to keep people out of pain, new drugs that created new opportunities for people that had different diseases. And when I saw this role advertised, I thought it pulled together a lot of my knowledge, skills and expertise and my passion to make a difference to people who are using health services and local government services. So innovation is about doing things differently, using new ways of working, technological change so that we get up to speed with new ideas, and using those new ideas to make a change for the people who come into the service. The Innovation Agency rolls out a range of innovations. I'm going to show you a few of them. So the first one I've got is a product called an Alive Core, and you can see the size of this. This fits on the back of a smartphone, and you download an app, and to take an electrocardiogram, which is an ECG, you put your thumbs on the sensors and it takes an instant reading. That reading tells you if you've got an irregular heartbeat or what's called an atrial fibrillation. If you have, your doctor can have a look at the ECG and prescribe you drugs to keep you healthy. And why that's really important is that those drugs can prevent you from having a stroke. So we've been rolling that out at the Innovation Agency across the North West, and our colleague organisations have been rolling it out across the country. So last year at the Innovation Agency we think we prevented 256 strokes. So that's people being able to work, they don't need carers, they have a healthy life. And we also think we've saved nearly £6 million by doing that. So this is an innovation that adds great value, and it also saves the health service and the wider social care service money and keeps people healthy and fit. It's quite hard to bring innovations into the health service because people are quite resistant to change. So there's something about students like yourself thinking about innovation, how you can put them into the pathways that you have as a clinician. It's also very hard because people are very, very busy. So in terms of having time to put innovation into practice, sometimes they just haven't got time to think about how they can change a service or change something they're doing with a patient. So that's how we can help, we can stand alongside people and help them to do that. A second innovation that I'm going to show you is an example of 3D printing. So this is a 3D printed kidney, and you'll see this kidney's got a tumour. Now this is an actual copy of somebody's kidney. So somebody's coming in for surgery, they're scanned and we get a copy of the kidney, and then this is grown overnight into a 3D print. So you see it's quite squidgy, like the texture of a kidney. And a surgical team can have a look at this product, see how big the tumour is, how deep we need to make an incision, how much you can take out without damaging the rest of the kidney. So this reduces anaesthetic time, it gives the team a great overview of what they'll be doing, and they can also discuss this with the person who's coming for surgery so they know exactly what's going to happen. So again, a great innovation, reduces costs of a health service, it frees up our operating theatres because we're spending less time for somebody else to come in, so we get more people through the system. And nicely for us at the Innovation Agency, it's produced in our region. So this is a company called 3D Life Prints. They're based in one of our hospitals, Alder Hay Hospital, and they're now exporting this product and using it in other areas of the country. A book you might have heard of is Robert Wachter, The Digital Doctor. Now this book describes the future of healthcare when we think about digital, and if you want to read this book, the first chapter is brilliant in describing a gentleman whose life is fully digital enabled. It tells him to change his diet, to walk a few more steps, to get his health check, and it's a really good read. Now Robert Wachter has been working with the health service and he's been talking to us about how to change things, and there's a digital plan. And one of the things that's in that plan is how to use sensors. And we've got a great example of an innovation in our region from a company called Red Ninja, and they've got a system called Life. And Life is about changing the traffic lights when an ambulance drives up to them. So they've mapped right across the country the routes that ambulances take, and you'll know that the difference, the 8-minute target for an ambulance getting somebody to hospital, that can be the difference between life and death. So as the ambulance comes up to the traffic light, it senses that it's there and it changes the traffic light to green. Now this all sounds really simple, it's actually a very complex operation. So they've had to map the traffic in different directions to make sure that they don't clog up whole towns with traffic. They've had to look at where to put the sensors, where the routes are. But it's an application of digital technology that will save lives and ultimately save money for the health service because people aren't becoming disabled and dependent on the service and the social care service moving forward. So the final product I'm going to show you is a product called Nocturna from a company called Polyphotonics, and this is for diabetic retinopathy. So if you've got diabetes, you're at risk of losing your eyesight, and at the moment you're going to hospital for observation, you're in overnight, you spend quite a lot of time having treatment for your eyesight. This mask, you'll see it's got little holes in the back of it. You put it on an eye and it emits low-level light into your retina. And that starts the cells in your retina to regenerate and you don't lose your eyesight. It's at the testing phase. Academic health science networks like the Innovation Agency have been supporting it and we've helped it to get funding, and we hope that it will start to roll out shortly. So there are a number of other forms of innovation. Obviously I've just shown you a few healthcare innovations there, and they don't all have to be technical. So we work with some products around health coaching, which are about enabling GPs to have a different conversation with the people who come to see you. So if a patient comes into a GP, the old model would be that they sit there, the GP would listen to the problem and they might prescribe a medicine or not, depending on what was wrong with the person. Health coaching is about having a conversation about what would suit that person's lives. So for example, we had a patient recently who went into a GP with great pain. He didn't prescribe painkillers, he talked to her about going swimming, about going out walking, and he arranged for her to go to some appropriate places to walk, to swim with ladies of her own age so she didn't feel self-conscious. And she started to become pain-free, she started losing weight, which has reduced some of the pressure on her joints. And that's a whole sort of wrap-round service of the GP talking with the patient, but also some social prescribing. There's also apps that you'll know about, a lot of healthcare apps, and we work with providers who look at those apps and make recommendations about which ones GPs can use. And apps are now being built into the GP prescribing system so GP can talk to the patient and actually prescribe something that's not medically based. As you'll know, there's quite a few barriers to innovation in the NHS. One I've talked about already, which is a lack of time for people to think about putting innovation into practice. One of the funding flows in the NHS, hospitals are funded differently than GPs. So you might start an innovation in one place and it will have benefits in another place who are funded differently, and nobody wants to pick up the cost. There's also a barrier sometimes with the public. The public don't like their data to be shared, so they might be frightened of apps, they might be frightened of giving the GP data, such I've shown you via live call, the records emailed to the GP, because they think someone will get access to the data. We also have issues with our commissioners, so commissioners also don't have a lot of time. They are the people who can make a difference in the health service by commissioning products. If they don't have time to think about it and plan for value, not just for cost, then there's a barrier to innovation. The barriers can be overcome by working as a system. So you see that the health service is reorganising. We've now got the 5-year forward view, which is a plan for the NHS, and that's organised systems into what we call sustainability and transformation partnerships. We've got GPs, we've got local authorities, we've got hospitals, community providers, all working together to make an impact on their system. So that's going some way to reducing the barriers to innovation being put into a whole system and making a difference to the people on the ground. The other way we can break down those barriers is by working with residents to say what do they want to be kept fit and healthy, and get their opinion and then match what we're producing in innovations to their opinion, so we get some push and some pull into the system to put new innovations into practice. Our students and young people are key to the work that we're doing, so a lot of students come into this with an open mindset. They can stand back and see the problems we've got in the NHS and in everyday practice and really make a difference in how they think and what they'll put into practice. So for example, I talk to quite a lot of students and lecture, and they talk to me about the NHS of the future. It won't be about people, it might be about robots doing surgery, products scanning to look for good diagnosis of people, so what can we scan the worldwide evidence to see what a diagnosis might be, and about using new methods of digital technologies to put into practice in the service. So if you're sat there thinking, oh, I know a different way to do this, you can shout out and talk about with your colleagues about how you make things different in the service. And we sponsor a number of schemes. We're a supporter of a clinical entrepreneurship scheme where doctors in training and recently graduated doctors come together with their great ideas, and we help them to develop them and put them into practice, so that if they're experiencing difficulties where they work because of lack of time or lack of money, they get some extra support to develop ideas into practice. So I think the future for the NHS looks very different than it is now, and if you want to read in more depth about this, Nesta have got a great report called Healthcare in 2030 that you can read. But I would like to think that as a resident, I'll have my app to look at my steps and how much exercise I'm taking. I'll also be monitoring what I eat, and if I go to my fridge and just think, oh, I'll have a bar of chocolate, my fridge will say, oh, you've eaten too many calories today and chocolate's not good for you. So I'll actually be looking after my own health in a different way. I'll then hopefully, if I need a GP, I'll be able to do a remote consultation. I'll be able to go online to chat to my GP. If I need to be referred to hospital, I would hope that my consultant will be able to do that remotely, so that I'm not having to travel great distances and I'm getting care that I need. But I think more importantly, we need to work with people so that they manage their own health. We need to educate children so that they start managing their health so they don't become ill and need to use a service. So I think people are starting to embrace this. They understand that the health system hasn't got a lot of money, but we've got great things we can do with technology. So I think together, working in the NHS and in social care, we can encourage people to take control of their own health and use the digital means and other innovations to make the service better. So if you're interested in what the Innovation Agency and the other academic health science networks are doing, we have got a video on the HSN network website. Please go and have a look at it. It'll give you an overview of what the 15 of us are doing together and how you can work with us to change the service.